So meconium aspiration syndrome. So meconium aspiration syndrome is associated with inhalation of meconium and amniotic fluid during fetal life or at delivery and is often complicated by significant pulmonary hypertension. So most common cause of hypoxic respiratory failure among term neonates. So don't confuse this with most common cause of respiratory distress is TTN, but the most common cause of hypoxic respiratory failure among term baby is meconium aspiration syndrome. So meconium aspiration syndrome is a primary diagnosis for significant proportion of those babies who are requiring extracorporeal membrane oxygenation, that's ECMO. So less than 10% of babies with meconium stained liquor develop RDS. So what it highlights is it's primarily so in the incidence of babies developing meconium aspiration syndrome is actually very less among babies who are actually having a meconium stained amniotic fluid. So clinical sign of MAS typically presents immediately after birth with tachypnea, increased work of breathing and cyanosis. Other common associated findings include metabolic acidosis, cardiac dysfunction, hypotension, postductal desaturation, indicating there is right to left shunting, which says that there is a lot of pulmonary hypertension. Now, why all these develops, cardiac dysfunction, metabolic acidosis, they may not be directly associated with the MAS, but probably when the baby passes meconium, even because of asphyxia. So asphyxia could be the reason for underlying metabolic acidosis or cardiac dysfunction. The risk of pneumothorax is 10 to 24% due to ball valve obstruction of the distal airways. But because of our very effective and advanced management, we now the risk of the incidence of pneumothorax is really coming down. X-ray shows diffuse fluffy infiltrates. So some babies have mild initial radio findings, and there is often progression of visible parenchymal disease over a period of time. This could be attributed to secondary surfactant deficiency. Now if you see this X-ray, this is a baby with the meconium aspiration syndrome. So it's a term baby delivered, and then so went in for hypoxemia where the baby has to be ventilated. So you could see the the endotracheal tube here, and then this is the umbilical vein. So you can see that the lungs which is there, you can see a lot of fluffy appearance here, lot of it's not uniformly non-homogeneous opacities. So all this indicates some of the alveoli are collapsed, some of the things are distended, or some are normal. So that is the picture of MAS. It won't be homogeneously affected unlike how we see in respiratory distress syndrome. So about 50% of the babies will require invasive ventilation, and the advent of nitric oxide and high frequency oscillator ventilation has improved the outcome dramatically. So some babies require even ECMO, and the survival rate on ECMO is dramatically improved to 94%. Preventive strategies that fail to demonstrate benefit is amnio infusion, and previously at the time of delivery baby used to intubate and they do intratracheal suctioning for babies who did not breathe at birth. But actually now as we go on, so there are this thing which says that the meconium, the aspiration cannot be prevented after birth because baby will make it attempts to breathe, or the baby would have aspirated meconium because of a gasping breath in utero due to hypoxemia.